Hi, I'm Dr. Jim Carlson, Riverside Animal Clinic. Just reporting some of the cases here. My daughter's at a horse show, so I wanted to get those out of the way on Sunday today. We're doing case number 02057, and hopefully you can see this on my cell phone. The 3-week, really 4-week areas, the SI3 is the communication line with the low back and the pituitary. And then the next two, we show endocrine imbalance. One is endocrine control, and then the other one's the adrenal. And then down under that, we see stomach. On the stress point, we see another endocrine, which is the pituitary itself. So a lot of what's happening is that we're seeing the sensory circuits and the neurohormones being imbalanced, and that's affecting the lower part of the body. The SI3 is how the front half of the body communicates with the lower half. So that can invite problems with muscle, skeletal injuries, knee injuries, urinary tract problems, large intestinal issues, even anal gland problems, because if we're not getting good communication with the front and the back, there's going to be imbalance. And that doesn't not limited to just the lower back problems, but that's also the front part of the body as well. So anytime we have imbalance or disease processes going on, we definitely have to fix the neurohormones. I'm going to back out of that and go into our sensitivities. And you'll notice that it's screened by groups, and then we go into the different files like food and then miscellaneous, for example. We see that environmentals, fossil fuels, and then in epidermals we see fabrics. And the fabrics, the material file that we went into, we can see a number of different fabrics here that you'll want to check your house to make sure that if you do have some of these fabrics, that wouldn't necessarily tell you to go ahead and sell your couch because we're not allergic, but we are sensitive to leather and nylon and things like that, so we might try some avoidance if we can. If we can't, then certainly by rebalancing, we're going to reduce sensitivities to some of these materials. So
how does that happen? Can you explain a little bit about how that happens?
The sensitivities are things the body doesn't adapt to. Initially when they're puppies, they're okay because they're usually balanced, but by the time they're a year old, they start to develop sensitivities. And those sensitivities can be to anything in the environment. And first of all, it's genetic, the genetic predisposition to being sensitive. And then the providing of things in the environment that set off these stressors and weaknesses.
Why would a fabric do that?
A fabric is contact. And so anytime the fabric contacts the skin, it's going to send a chemical message to the body that says, okay, I need to be on alert about this. So the immune system reacts to it, creates potential for inflammation. So that's all up
So
alarm
just by
points.
coming in contact with it?
Just contact, yeah.
Wow.
Then I suppose if it chewed on the leather, that could be something as well. More intimate contact, maybe even ingesting some of the material. But far and away, this is going to be being in contact with it.
Okay, all right.
So the only other thing on here, fossil fuels, unfortunately, are going to be related to petroleum products. So that's going to be ethanol, it's going to be diesel fumes, it's going to be propane, natural gas, and unfortunately these are things that they're always going to be around. So are we. If we're sensitive to it, we want to make sure that we stay balanced, because any sensitivity is going to send off an imbalance somewhere in the body. So if we use the micro infusion hemp oil product to rebalance, we're going to use those for 5 drops a day. That'll reset those weak and stressed areas on the base point reading. We're always going to be sensitive, so there's not going to be any change to that, but at least you'll notice on the base point testing that the allergies were normal, so at least we're not allergic to it. But unfortunately, the sensitivities are for a lifetime. But fortunately, a short list, so not anything that's too serious. But at the same time, we'll get this balanced out for you. Thank you.